right now.
From the station working for you, this is WRTV News at 6, streaming now.
All eyes on the FDA tonight, waiting for the agency to give emergency approval to Pfizer's COVID-19 vaccine.
The goal is really to provide immunity to the population, right? So that we can return to some sense of normalcy that we all want.
You have a lot of questions about the coronavirus vaccine, and tonight we are taking your questions to the top, getting you answers. What you can expect as soon as the vaccine arrives.
If I wake up, it's a good day. I just kept going.
A farmer is ready to get back to work after he received a new heart in the middle of the pandemic. We show you his journey and what doctors need you to know right now.
Rain arrives tonight. When will it leave, and what follows the rain?
Well, happy Friday and welcome in to the news at 6. I'm Mark Mullins. First tonight, the wait continues for the FDA to give emergency approval to Pfizer's COVID-19 vaccine. That emergency authorization could come at any moment. Last night, a U.S. government advisory panel recommended that the FDA approve the vaccine, and the FDA usually follows that panel's recommendations. FDA Chief Stephen Hahn says the agency is working rapidly tonight. The Associated Press reports that White House Chief of Staff Mark Meadows has pressed Hahn to give the emergency approval tonight. We'll keep you updated on what happens here on WRTV and on the WRTV app. Tens of thousands of doses of Pfizer's COVID-19 vaccine will arrive in Indiana next week. Our Alyssa Donovan spoke with local health experts about what the vaccine means for you and the state of the pandemic moving forward.
Next week, more than 55,000 doses of Pfizer's COVID-19 vaccine are expected to arrive in Indiana. But that doesn't mean stop wearing your mask or stop social distancing. Experts say it will be a while yet before we return to any kind of normal.
I would be first in line to take this vaccine if it were offered me today.
Tom Dzinski is the Director of Epidemiology Education at IUPUI. And like many of us, he will not be the first or the second in line to be offered the vaccine. The state will start by distributing the vaccine to frontline healthcare workers.
Protecting them is going to be really important in making sure that we have hospitals and clinical settings up and running.
Because of the limited doses, experts say it will likely be months before we see an impact on COVID numbers. The vaccine requires 2 shots over the course of 28 days to reach full immunity. The first delivery to Indiana will include 55,575 doses.
That's only enough to vaccinate 27,000 people.
Dr. Cynthia Brown is heading up the AstraZeneca trials at IU School of Medicine, and she's well versed in the status of the other vaccines, Pfizer and Moderna. She says the goal of all the vaccines is not to eradicate COVID-19, but to slow the spread.
We've only ever had one successful vaccine campaign that eradicated a disease, and that was smallpox.
Slowing the spread depends on reaching what's called herd immunity, a large amount of vaccinated people within the population.
This vaccine is 95% effective. So we actually need to vaccinate more than 70% of the population because we know 5% of them won't develop enough antibodies to protect them.
But it will likely be a long time before we get to that point.
We have a healthcare worker population that's 350 to 400,000 individuals. So it's going to be a while before we get those doses.
State health officials expressing uncertainty about just how many more doses are on the way.
We anticipate receiving additional vaccines every week, but we do not know what those amounts will be.
I'm confident by saying this time next year that we'll be, all together for Christmas again.
As of now, it's too early to tell how long immunity will last in those who are vaccinated, or if this will be the type of vaccine that we need to get more than once. I'm Alyssa Donovan, WRTV.
We requested and received the state's COVID-19 vaccine plan in October. So as Alyssa just mentioned, the Department of Health says its vaccine allocation committee prioritized the healthcare workforce and those people who are at greater risk of death from the virus for phase 1 of the COVID-19 vaccine distribution. Among the general population, long-term care residents would be prioritized. So would people with underlying medical conditions, those who are 65 years of age and older, people at risk for severe COVID-19 illness, those at risk of acquiring or transmitting the virus and people with limited access to vaccination services. State health officials say they expect most of the general population to get vaccinated in the spring and summer. Tonight, we asked people in central Indiana if they plan to get the COVID-19 vaccine once it's available to them. And as you'll see, people are looking at this through different perspectives.
No, because I've already had coronavirus. I've already been tested positive for it, so I don't think it's going to mean a whole lot to me. And plus, I'm a little bit afraid of it, just because it hasn't been tested quite enough. So I don't hardly even get the flu vaccine, so so I'm pretty healthy and I usually get over stuff.
Oh, I'll definitely get it. Yeah. Because I've had cancer and diabetic both, and I got COPD. So
no question.
No question about it. I'll definitely get it when I can get it available to me.
I'm not sure yet. I don't know yet. It's something I've got to think about.
Is it just something that you just don't know enough about yet?
Yeah, me and my husband both, we want a little bit more information before we just make our decision.
We recently spoke to the nursing director of infection prevention at IU Health, Kristen Kelly. We asked her what she would tell people who are worried about or not sure about getting a COVID vaccine.
One, our jobs in the healthcare community, as a nurse and our fellow physicians and our pharmacists that are trained in understanding this scientific data are going to do everything that we can to make this understandable. So we are going to take all of the studies, all of the information, and we are going to begin a very robust educational campaign so that we can deliver all the education that people want so that they can get their questions answered. It's up to us to make sure that we educate folks, that they weigh the pros and the cons, that they understand what they would be getting into if they choose to take the vaccine. We are really encouraged by the safety and efficacy data, and we want to help to boil that down so that folks understand it and can really make the choice that's best for them and their families.
And right now on WRTV.com, everything you need to know about COVID-19 vaccines. We've got information in a question and answer format, so it's easy to follow and understand. Plus several stories you'll want to see as Indiana starts receiving the first doses of a COVID vaccine. That's all on WRTV.com/coronavirus. And as we wait for the arrival of a COVID vaccine, the pandemic continues to take lives here in Indiana. Data from the Indiana Department of Health shows 71 additional COVID-related deaths. 6,373 people in the state now have died with the coronavirus since the pandemic began. The Department of Health also confirmed 7,360 additional COVID-19 cases in Indiana. Now, a total of 412,135 Hoosiers have been diagnosed with the coronavirus. There is a new online database that tracks COVID-19 in a different way. This year, researchers from the Paul H. O'Neill School of Public and Environmental Affairs at IUPUI developed an online dashboard that tracks many executive orders nationwide that aim to slow the spread of the coronavirus. We're mainly talking about executive orders from governors' offices. Even right now, Governor Eric Holcomb has an executive order in place that continues county-based measures and restrictions to help stop the spread of COVID-19. So we asked one of the developers of the dashboard why he thinks it's an important tool.
It's important now because it helps us to understand what was and wasn't effective, because what you can do is you can look at these policies and you can, we can't really make causal arguments, but we can correlate them with how the virus spreads and with hospitalization rates, with death rates, with rates of social distancing, all these kinds of things. And so we can see sort of, what works best, what in this sort of toolbox of policies really works the best.
He says he hopes this helps lawmakers and the public understand which executive orders worked and which didn't in the fight against COVID. To look at this dashboard showing executive orders, go to COVID19EOS.net. A lot of things have been put on hold during the pandemic, but some doctors are urging you not to put your health on hold. At Ascension St. Vincent, doctors say they are still seeing people skip routine health screenings, visits that can be made safely and effectively virtually or in person if need be. WRTV's Amanda Starantino spoke with a farmer who is ready to get back to work after safely receiving a new heart in the midst of a pandemic.
Richard York is a family man and a farmer.
We grow soybeans and corn and wheat and barley and everything else. It's just the adventure of doing something and watching what you did grow and then harvest it and take it to town. Because I love it. I truly love it.
In 1992, he was diagnosed with cardiomyopathy, a weak and enlarged heart. His condition started rapidly deteriorating in the last few years, and the man who loves to put in the work in the field was taken off the farm.
And I farmed until 6 years ago. And then I had to quit because her was starting to get bad. He was just wore out all the time.
In May of 2019, Richard was put on a heart transplant list. But with his condition, his window of opportunity was shrinking. 18 months later, he got the call that a heart was available for him in Indianapolis, which also meant an invasive procedure at a hospital in the middle of a pandemic.
You don't have no choice. I mean, hearts don't come up every day. So you got to take advantage of it when it comes. So, and I knew if I'd quit, the chance maybe never come again. And I knew myself I wouldn't last a whole lot longer. So I thought, just stay on the list and see what happens. If one comes, it comes. If it don't, I was content.
The now 66-year-old's commitment to his health is keeping him disciplined with his medical visits, both in person and virtually when possible.
Mr. York is doing unbelievably well. He is basically back to doing his normal levels of activity. I anticipate that he'll, if somebody didn't know him, they wouldn't have any idea that he actually had a weak heart in the past.
Dr. Sunit Preet Chaudhry is Richard's cardiologist at Ascension St. Vincent in Indianapolis. The fear of the pandemic has kept many Hoosiers straying from seeing their doctor, but skipping routine health screenings can create even more problems.
We don't know how long COVID is going to be around for. My personal feeling is that this will be something we'll have to live with at least for the next few months. And unfortunately, as people know, health problems or medical conditions don't wait for COVID.
And there are options that are safe to make sure your health stays in check. Here at Ascension St. Vincent, Dr. Chaudhry says they have been doing virtual visits as much as possible.
A lot of medical care is actually just listening to the patient, but we are able to use things such as smart devices and phones to actually see the patients face to face. And I would say the majority of what we need to do, or if we think that they need to be seen in person, that can also be accomplished through a virtual visit.
Continuing his care through the coronavirus pandemic is what has allowed Richard to get back to the farm and his family.
If I wake up, it's a good day. I just kept going, and then I promised my wife and I promised them I'd stay around as long as I could to keep Diane happy. So I just, and I'm one of them kind, if I make you a promise, I'm going to do everything I can to keep it. And I feel good now. I feel really good. That's amazing.
And that was Amanda Starantino reporting. Richard also says he recognizes how someone is no longer here, which is why he has a new heart. And he hopes to make that person proud by making sure their heart is put to good use. You may see the term Secret Santa or Secret Sisters and think, that sounds fun and harmless. You give and expect a gift in return. But the warning you need to see, the scam associated with this that could cost you a lot of money.
And map looking colorful tonight. It's warm out, but that will be replaced by much colder air. We'll talk about the transition time coming up.
Welcome back. Sometimes they're called Secret Santa and Sister exchanges. They seem fun. You give and expect gifts in return. But beware, they can be pyramid schemes. Mallory Cephastay with our Script Station in Baltimore shows us you won't receive a return on your investment, and you're giving up something else too. It's day 5 of our 12 scams of Christmas.
They go by a number of names: Secret Santa, Secret Sister, Holiday Wine Exchange, the Blessing Loom. No matter the name, know that these schemes are illegal and cost you more than you think. A way to brighten someone's day, receive a little something in return, and the Secret Sister gift exchange doesn't require a huge buy-in.
I'm running the risk that if I give somebody $1, the last 2 or 3 people on that list are going to give me $1. That's a really simplified version of it.
But Angie Barnett with the Better Business Bureau said you likely won't receive anything and are giving away your personal information. These schemes, however, can become costly when more money is involved, like with the Blessing Loom or Cash App Circle.
People were receiving notifications that all they had to do was invest $500 to get $5,000.
Participants would load up prepaid cards, then wait for their investment to grow.
Money is to be made by those at the top, and the further out the circle goes, when I bring in friends to invest and then they bring in friends, the money dries up. There's not enough money to support that large group, and the pyramid literally collapses.
Barnett said these online scams became more prevalent right as the pandemic hit.
People were losing money at a time when they could not afford to do so.
In addition to being a poor investment, these schemes are illegal. The U.S. Postal Inspection Services considers it a form of gambling. It's also illegal to mail alcohol via USPS. So if you receive one of these invitations, just ignore it or report it on the social media platform. With your 12 Scams of Christmas, I'm Mallory Safaste.
What do you do when temperatures reach the 60s in December? A lot of folks head right to the Monon or to Eagle Creek Park or Fort Bend. You can bet. Get outside and enjoy it. We will not have temperatures that mild within the 7-day forecast, and who knows, could be quite a while. We won't pull it out right from under you tomorrow. We're still in the 50s, but after that, in the 30s. We missed historical credit by 1 degree. 65, the high today. The record goes back to 1931, and that was 1 degree warmer. Temperatures right now in the upper 50s as we set the stage for rain to push into central Indiana. It's already happening toward Terre Haute. I'll show that to you in a second. But we stay very mild tonight with little temperature change. In the 50s is where we'll be in the morning. We're in what we call the warm sector of this storm system. That will ensure all rain for us. There is snow on the cold side of this from Omaha back into portions of central Iowa and Wisconsin. As far as us, we have the rain in Terre Haute on up into Rockville, southern portion of Park County. That's moving northeast and will continue to expand this evening. Notice temperatures just nudge down a little bit, 54 degrees as the rain settles in. As far as what we expect overnight tonight, widespread rain by 11 o'clock as we go through the overnight. You may hear a rumble of thunder even in the morning tomorrow. That's 10 a.m. and then by 1, I think the rain becomes far more spotty. Rainfall 1/2 inch to maybe 3/4 of an inch in Indianapolis. Some areas may see a little more than that. You can see how the rainfall potential just really drops off once we get toward noon in Indianapolis. It'll linger a little longer to the east-northeast. There's the magic number. That's a morning high tomorrow. Much colder on Sunday. There's the progression of temperatures tomorrow by 3 o'clock, 50, and then we'll fall into the 40s after that. 7-day forecast, if you're looking for some winter weather, we'll have at least a chance for some light snow or snow showers on Wednesday with highs in the 30s. As you can see, 35 for the high. Some other spots just in the low to mid 20s for overnight low temperatures. Mark?
All right, the cold weather is on the way. Thank you, Kevin. This weekend sees the Pacers getting their first preseason test. The Butler basketball teams are on hold for a bit longer. And Ball State's playing a very important football game up in Muncie. Brad Brown has a look ahead at all of those.
A new head coach and a few new faces have brought a new energy to the Pacers as this new season gets set to begin.
Training camps are hard, whether it be this one here in Indiana or any of them. I'm sure they're tough to go through, and players around the league are fighting through everything and getting themselves in shape and ready to play these preseason games coming up.
Coach Nate Bjorkgren is already putting his touches on revamping the Pacers' approach at both ends of the court. So far, he's getting some very positive reviews from his players.
Incredibly creative, incredibly interactive with the players. Definitely a player's coach. You know, I'm excited about that. We're in need of some creativity, and I think that's what he's going to bring to the table.
And the learning curve is much shorter. A shorter offseason, shorter preseason, and the unknowns of how it will all come together with the pandemic looming all around.
Doing what we've been doing in training camp has been done very well. So we just got to continue to build on it, even when, like I said, fatigue sets in and we get tired. Still got to be crisp. We still got to be locked in. So we've been doing a great job of that.
The Pacers will play 2 preseason games in Cleveland tomorrow and Monday, and 1 more at home next Friday. The regular season opener is set for December 23rd at home against the Knicks. Butler is making some more changes to its basketball schedule. The men's team has added a home game against DePaul on December 21st. BU has not played since their opener, pausing all activities due to COVID-19 positives. The Butler women's team announced Thursday that they are taking a COVID-19 pause as well. They'll miss 3 games as a result, including tomorrow's against IU. Ball State's football team lost its first game this season, but the Cardinals have rattled off 4 straight wins since, and tomorrow they'll play for a spot in the MAC championship game. BSU is hosting Western Michigan.
There's going to be a lot of talk this week about what's at stake, but our guys are just focused on the next game. We got to take care of business, and nobody, the good thing is it's a mature group of guys, with 22 seniors and guys that have played a lot of football and have been around.
Ball State put up a season-high 45 points last weekend in a win over Central Michigan. Drew Plitt threw for 366 yards and 4 touchdowns.
I think just with winning, everybody's in a better mood when you win. And the opportunity that we have is huge. We know that, but we're not going to change what we do. If anything, we're just going to do a little bit more and really just take it one day at a time, keep moving forward.
Tomorrow's winner will play for the MAC title next weekend in Detroit.